Imagine being a sought-after tennis instructor who all of a sudden can't seem to serve the ball. When this first happened, Gerhard Schubert was in his early 30s, so he was surprised when he was diagnosed with Parkinson's disease. Parkinson's is a disorder of the brain that leads to tremors and other movement and coordination difficulties. There is no cure, and symptoms get worse with time.
Typically in the morning when I get up, I crawl to the bathroom. I can't walk to the bathroom in the morning when I get up. It takes about 45 minutes to an hour for the meds to kick in.
After living with Parkinson's for 20 years, Schubert's medications became less effective. That's when he and his physician, Dr. Jason Schwab, discussed deep brain stimulation therapy. In DBS, electrodes are implanted into the brain and connected to a small neurostimulator that is programmed externally. Traditionally, the surgery is performed while the patient is awake, but at Henry Ford Hospital in Detroit, doctors are now using a new imaging tool called Intraoperative magnetic resonance, or iMRI, which allows Parkinson's patients like Schubert to be asleep during surgery.
It's a great option for patients who are either unable to tolerate awake surgery with brain mapping or don't want to. So my hope is that this will open up avenues to other patients.
Because the living brain moves, the iMRI makes deep brain stimulation surgery much more precise by acting like a GPS. This helps doctors place the electrodes with greater accuracy on the affected parts of the brain to ease the movement disorder.
It wouldn't surprise me if in 5 or 10 years we're doing things almost exclusively this way. This technology has a significant advantage in that you know with 100% certainty that you've got the electrode in the right place before you close the skin.
Before his DBS surgery, Schubert was a physics teacher at Lakeland High School in White Lake, Michigan. He hopes to return to teaching soon. Schubert is doing things now that he hasn't been able to do for a long time, and he's taking significantly less medication.
I just know that I'm doing well. I'd say it looks a whole lot better than it did prior to surgery.
Dr. Schwab says iMRI takes deep brain stimulation beyond previous advances in Parkinson's treatments. Although DBS with iMRI does not stop the progression of the disease, patients are showing remarkable improvement thanks to this advanced technology.
Without a doubt, the iMRI procedure helped me. I don't know if I'd be here today.